You know, I've been working in the Lyme field since the early 90s, and one of the things I've learned, especially in the last 10 years, is that the only way to make science move really fast is if you have excellent collaborations. And one of the, especially in this current age of big data and systems biology, where different people around the country have different areas of expertise, we absolutely need to find the best people around the country who have expertise in different areas. And Stanford has, as you know, an enormous number of strengths. And I've had the pleasure of collaborating with Bill Robinson in immunology, and I look forward to collaborating with others at Stanford as well, towards the goal of trying to clarify what's going on immunologically in these patients with both early and later stages of Lyme disease, developing better diagnostic tests, clarifying the phenotype of post-treatment Lyme syndrome, for example, is really important. Clarifying what happens to patients when they get co-infected with another agent, but also perhaps have Lyme disease, and how the two of them interact to create perhaps a different clinical picture, and in addition possibly a different immunologic profile. So one of the advantages of what we do here at Columbia is that we have access to a lot of patients, because we have Pennsylvania right next door, or we have Westchester just moments away from where I am here at Columbia. We have the Lyme-loaded areas of Dutchess County, New York, and Columbia, New York. We have Connecticut and New Jersey. So in many ways we're a epicenter where people can easily come for studies. So right now we have a number of studies where we're collecting samples which can be shared with collaborators around the country, including at Stanford, of both early Lyme disease and post-treatment Lyme syndrome. We have some treatment studies ongoing as well. You know, when I spoke in DC, I was talking to the American Academy of Science Fellows. I was trying to educate them about what the various symptoms of Lyme disease are. And obviously the least troublesome symptom is the Lyme rash. When you get the rash, you get it treated, the vast majority of patients get better. If you're unfortunate and it affects your heart, you can have arrhythmias, which could lead to death, could cause carditis, inflammation, or pericarditis around the heart. If it affects your joints, you can have bad arthritis, and that in some cases, maybe 20% of cases, might go on to develop into an autoimmune type of arthritis. If you're unfortunate and it goes into your central nervous system, you might develop a meningitis, where you have severe headaches, stiff neck, nausea, confusion. If it affects your brain tissue itself, you might end up getting encephalitis, and patients with encephalitis could present with confusion, disorientation, hallucinations, paranoia, even seizures at times. And I certainly have encountered patients whose first presentation of Lyme disease was paranoia, and it was a waxing and waning paranoia. And only after several months did it flower into a full encephalitis picture, where the person was admitted to the hospital and the spinal tap was done, and it showed the Lyme antibodies. So, you know, it's important for people to realize that Lyme disease has many different manifestations, not just the ones that are described by the in the surveillance criteria by the Centers for Disease Control. I think in the late 1980s, Dr. Andy Packner, who was a neurologist at Yale, wrote a paper called Lyme Disease, the New Great Imitator. And in that paper, he reported and described in beautiful clinical detail a number of different clinical manifestations of Lyme disease that masqueraded as other diseases. And sometimes it might appear to look like multiple sclerosis, clinically at least, and sometimes and in that particular paper there was a young boy, age 12, who developed an severe obsessive compulsive bicycling problems such that he lost so much weight that he was admitted to the psychiatric facility at Yale with presumed anorexia. And it turned out he had previously had a diagnosis of Lyme arthritis, so they ended up doing a spinal tap, seeing abnormalities, treating him with intravenous antibiotics, and the compulsive bicycling and anorexia went away. So these are all remarkable cases that could easily be missed if you didn't know that this is a disease that can have many different manifestations. You know, you're extremely lucky and fortunate if you see the rash. And most people do see the rash because it tends to expand in size and it can be there for a number of weeks, so oftentimes it is seen. But if it's in your hair, for example, or on your back, and you don't have good fortune of someone checking your back, you may not see it. And in that case, then you may have some flu-like symptoms that may go away, and then many months later you might suddenly find that your memory starts to falter. You may have a hard time finding the words to say what you want to say. You might put the wrong words in. You're not sure what's going on. You're only 35 years old. You shouldn't be having these problems. Or you're 16 years old. This doesn't make any sense. People start to wonder what's going on with you. You're extremely fatigued. You're like needing to take naps during the day. You're exhausted when you wake up. You can't concentrate in school or at work. You start becoming dysfunctional. In addition, you might become irritable as well, and that irritability can also look like depression. So sometimes people are told that they have depression, and sometimes they do have a full-blown depression. But sometimes it's more the irritability that comes with being sick and maybe having a central nervous system infection. So how common is it? People, in studies that have been done of neurologic Lyme disease, about 20 to 30% manifest with significant irritability along with other symptoms. So it's quite common to have depressive and irritable symptoms. The other symptoms that I mentioned, like psychosis, would be rare, and full-blown obsessive compulsive disorder would be rare, but they certainly can occur.